Dr. Garg. I just want to address for those out there in the population that maybe don't know what to look for. What are some of those general risk factors, symptoms, and indicators that an individual should be looking for with regards to some of these conditions we talked about?
Yeah, so I think in general terms, first of all, if you're just looking at from a very starting point of view, then I think your weight, for example. Obesity is a major symptom of that you are something not going right. So you need to be aware of that. In terms of able to measure, obviously general health. So do you feel tired? Do you feel like you have to go to bathroom too often? Any of those changes become important. But I think the one parameter or one thing people don't think of is blood pressure. I would say if there is a message in our conversation, message is know your numbers. And the blood pressure will be very high. Obviously the waistline, the body mass index, all those things are important, but blood pressure, I think, is the key. As they say, blood pressure is the silent killer.
Excellent. That's a great list. So, what can people with risk factors do to prevent kidney disease and other similar chronic diseases that impact the South Asian community?
Yeah, I think kidney disease, in some ways, you could say, is the outcome of other things. Poor kidney, just visualize, kidney just doing its job, day in, day out, filtering, pressing, keeping us all well. But if we keep loading it with certain things, it shouldn't be there, then it starts to get worried. So kidney diseases, the prevention of kidney diseases to a great extent is prevent some of the diseases which causes it. So I think to delay diabetes, you also delay kidney disease. And to delay diabetes, we come back to our lifestyle and behavior modification important.
I'd love to kind of ask you what the impact of mental health is in the South Asian community who live with chronic kidney disease, and how do we address that?
Well, that leads right into yoga, so thanks for asking. But obviously, mental health comes in many shapes and many ways, right? And the first thing is, on one hand, people are not that reluctant to talk about physical illnesses. Like you break your leg, say I broke a leg, people have a cast, people will autograph it, right? So it's okay to talk about it. You have diabetes, people are willing to talk about it. The biggest problem I see in our community with mental health is that we are still very reluctant to address it head on, and we don't talk about it. There is a certain amount of stigma attached to it. So I would say that is a huge problem or huge issue. I mean, it's true everywhere, but in South Asian heritage, that's even more so. So I think we need to make a concerted effort to say it's okay to talk about it, get help.
When we talk about mental wellness and feeling good about ourselves, we talked a little bit about yoga. So what are some holistic approaches one can take towards their health?
Yeah, I think in general, I would like to start out by saying in no way we should downplay the science of acute care or what we do. Like as a medical doctor, 40 years, day in, day out, I did it. And I saw how beautifully it works. So there is no part of my conversation in any way says do this but not that. So what I'm talking about is how can we bring fullness to this conversation rather than only part of it. And this is what I have termed called internal interventions. So I see external interventions and internal interventions. So external interventions are things which are done to you. You have a problem, you go see a doctor, doctor gives you a pill, you take a pill, you feel better. You have a high blood pressure, you take a pill, you feel better. That's external interventions. You really don't have much control on it. You are a passive passenger. And I think it's very important. If people are listening or watching, I would say you must seek that help. You can't just say, oh, it will be okay, I don't have to do it. Or it doesn't work. No, it does work. While we are learning everything about acute care, so-called looking after in the minute amount what we are doing, if we start to also think of the person as a whole, what is holistic approach to health, that will, I think, help in chronic diseases.
All right, everybody, stay with us. We'll be right back.